rose by 4% last year as people continued fleeing wars, violence, persecution and human rights violations despite the coronavirus pandemic. Kimani has more.
According to this year's UN Global Trends report, 6% of refugees worldwide are hosted in developing countries. Global forced displacements have risen for 9 consecutive years, as per the report, which also indicates that today 1% of humanity is displaced, and there are twice as many forcibly displaced people than in 2011, when the total was just under 40 million. Africa hosts nearly 6.6 million refugees, 4.5 million of whom are in the East, Horn of Africa and the Great Lakes region. Uganda and Sudan each host at least 1 million refugees, with Ethiopia following closely at 800,000 people. Uganda is one of the top 5 refugee hosting countries globally. Neighboring South Sudan is the 4th highest refugee producing country in the world, with 2.2 million South Sudanese refugees in mainly Uganda, Ethiopia and Sudan. 6 out of the 10 highest refugee producing countries are in Africa. The report further states that, driven by crisis, Ethiopia, Somalia and Sudan were among the countries that registered the highest number of internally displaced persons, that is IDPs, globally, with a total of 2 million people newly displaced in 2020. The UN Refugee Agency warns that despite the ongoing coronavirus pandemic and calls for a global ceasefire, conflict continues to force people from their homes, as well as impacts of climate change, such as floods and droughts. More than 2/3 of all the people who fled abroad came from just 5 countries: Syria, Venezuela, Afghanistan, South Sudan, and Myanmar. The report also notes that at the peak of the pandemic in 2020, over 160 countries had closed their borders, with 99 states making no exception for people seeking protection. Kimani, SABC News in Kenya.
The United Nations Refugee Agency has urged world leaders to step up their efforts to foster peace, stability and cooperation in order to halt and begin reversing nearly a decade-long trend of surging displacement driven by violence and persecution.
It was the memory of his friends dying from preventable diseases that inspired South Sudanese refugee Samuel Dole Ayuen to become a doctor. Today, he's helping save lives in Uganda's capital, Kampala, amid the global health crisis.
Most of my peers were claimed by measles. They died, and I was fortunate enough to have survived, despite the fact that there was no medical care at that time. So you were just at the mercy of the disease.
Ayuen fled civil war in South Sudan as a teenager in 2013. He and his family are among an estimated 1 million South Sudanese refugees who fled to Uganda. A total of 1.5 million refugees live in the country, making it the 4th largest refugee-hosting nation in the world, according to Wendy Kasuja, a spokesperson for the United Nations Refugee Agency. Uganda permits refugees free movement and access to public services, but Kasuja says many still face difficulties.
We have only about 20% of the refugees who are supposed to be in secondary school accessing it.
Ayuen was one of the lucky ones. After attending public high school, he won a scholarship to Makerere University in Kampala.
Considering where I've come from, my parents were really excited. They even had to commute all the way to come all the way from the refugee camp, despite the challenges, to come and witness my graduation, because that was the first degree in the family. My mother has never been to school before.
Ayuen now works at the prestigious Mulago National Referral Hospital. Being a refugee, he says, is not a punishment.
It is an opportunity to continue with your dreams outside your country.
He says he wants to specialise in neurosurgery and return to South Sudan, where he can pass on his knowledge as a lecturer.
Hi, my name is Ulrich Hendricks and I report for the SABC from the Northern Cape.